today actually they made the announcement that that they'd be opening their pediatric nursing department, which is great news. But I know they'll still be interested in finding ways to recruit more nurses. Actually, to help us with that conversation, we've got Kathleen Ho. She is the Deputy Director of Nursing at the Guam Regional Medical City, joining us now. Kathleen, thanks so much for taking our call.
Hi, good afternoon.
Good afternoon. Congratulations on getting the pediatric wing back open. It's opening August the 7th, is that right?
Mm-hmm. Yes, that's true. That's true.
Oh, okay. And how is it that you were able to get enough nurses to open the pediatric department once more?
So we have contracted some of the travel nurses to fill in the position, and also we had some local hires. So, which makes it easy for us to go ahead and reopen the unit after being down for about 3 weeks.
Oh, okay. Now, what are travel nurses?
Okay, travel nurses are from agencies in the mainland, and that's mainly their job. They're experienced nurses enough to be independent on their own with their practice after a week of orientation, getting to know the department. So they're basically experienced nurses that does like travel assignments, like 13 weeks is mostly 13 weeks of assignment. So, and then
the local nurses that you were able to hire, were these just nurses that were between jobs, or are they nurses that already have jobs? How does that work exactly?
Okay, a lot of them are, already have, what do you mean by, I'm sorry, jobs that they already have?
Oh, well, I mean, like a lot of nurses that I speak with work for a couple of different places. Like they'll work here during some hours of the day, and they'll work here during some hours of the day. It just sort of depends.
Oh, no, these nurses are actually the ones that, came back on island. They have gone to school off island, and then now they're coming back.
Oh.
So we're considering them as local hires because they're basically, Guam is their home.
Oh, I see. Now, I was thinking maybe you could tell me a little bit about the situation with the H-2B nurses. How many nurses do you have total at the hospital, and how many do you need?
Okay, we had about close to 70 nurses when hospital first opened.
Okay.
And most of those nurses were part of the denials that's been going on. So some of them, actually most of them, have left already the island.
Oh, okay.
And there's only about a few left which have converted to a different type of visa that allows them to stay and work in the U.S.
Oh, is that right?
And they continuously working with us.
Oh, okay. Now, where, is there a particular university or hospital that that we seem to get most of our nurses from? The ones that are from overseas, the one that we had been hiring from with the H-2B visas. Oh,
for the the ones for the H-2B?
Yeah.
It's random because when we opened for in the Philippines, like opportunities, right?
Yes.
So we opened it not strictly for looking at just certain hospital or our parent hospital, which is TMC. We actually opened the opportunity to other nurses outside of the medical city.
Oh, okay. So
I can't really say, I don't have like a statistics or percentage of how many are from different hospitals. So because we opened it up, we opened the opportunity for others, not just the medical city.
I see. And so when you opened that up, you had plenty of applicants, people that came in. Now, what I wanted to do was to talk about how the hospital is operating now that you've recruited these 25 other new nurses, over the past 3 months. Will you have enough nurses to operate?
Yes, we're actually slowly opening up more beds.
Okay.
more beds because it's been a struggle, and I believe you probably heard it already that we have to close up some services. So we're looking at of course reopening those services and actually increasing our bed capacity because we now have our fifth floor. So that actually gives us, because those are the rooms that we were waiting for to open. So.
Oh, I see. Now, how many nurses do you need per bed?
It depends on, the nursing ratio depends on the acuity, the level of care that the patient needs.
Okay.
So ICU, it actually is different because that's mostly, very those are very critical patients, and they need like a 1-to-1 to 2-to-1 nursing ratio. So it depends really on the level of care.
Okay, and what about the level of nursing? What are the nurses, the types of nurses that you need the most?
Right now we need, of course, our critical need right now is, of course, pediatric, because we want to open up all the possible services we can offer for our pediatric. We also would need nurses for our labor and delivery unit, nursery, and ICU, with neonatal intensive care unit. So those are the departments that we're focusing our recruitment right now.
Okay, so if you've opened the 5 beds in the pediatric department, and after making this announcement, I shouldn't worry that anybody at pediatrics is understaffed, because once the department is open, you've got enough people.
We were not going to open it if we don't have enough staff. That's why we're right now it's limited to 5 beds, but looking forward on increasing as we get more nurses. We want to make sure that we have enough staff to staff it safely. I see.
Well, thank you very much for taking our call. Is there anything else that you would like to say about the nurse situation at Guam Regional Medical City?
Well, for me, we're just really, hoping that we could get more. We're still waiting for our local graduates from our university to get their nclex nclex test pass and get licensed so that they can start working.
Oh, okay. So you've got your eyes on potential graduates, and they just need to pass their NCLEX, and there are some positions you will be able to fill with them.
Yes, we'll be more than happy to take them in and grow them in the profession. So we're looking forward for that, and I think they graduated about 20-some nurses.
Oh, okay.
For the 2016.
Oh, I see. So this
23,
is 23,
I think, to be more specific.
23.
And 23 graduates
I
from
hear
our University of Guam.
Oh, okay. I hear a very deep-voiced helper in the background. He must be a nurse, a male nurse.
I'm just like I said, I'm just trying to remember, and somebody just give you the exact number.
No, I know. It's like everybody wants to be helpful. I was talking with Margaret Hattori just yesterday, and she was telling me that not every year that they've got graduates they can put all of the nurses to work, but this sounds like this is a good time to be graduating as a nurse because of the need.
Exactly, and we've from their past year, their graduates, we have about 7 or 8 of them already working with us.
Oh, is that right?
And I myself is a graduate of UOG. So.
Oh, you are, huh?
Yes.
Okay.
I'm alumni.
Well, I tell you what, we would be more than happy, on some day, if you want to come by the show, and because we're always interested in what happens to our nurse graduates, and one of the celebrated programs at the University of Guam, and so chatting with you and some of the other nurses that are various stages in their career, I think would be interesting to our listeners as well.
Sure. We can have that discussion, and I will bring. We have more than a handful of them here.
Wonderful. Well, that sounds terrific. Well, thank you very much, Kathleen, for making the time for us today. Kathleen Ho, the Deputy Director of Nursing at GRMC.
Thank you also.
Oh, you're welcome. Good chatting with you. So, good news from GRMC, the Pediatric Unit, reopening Sunday, August the 7th, Sunday, and they say they wouldn't reopen the ward unless they had a sufficient number of nurses on hand to staff the unit around the clock.